Hello everyone. Assalamu alaikum wa rahmatullah. Today, inshallah, we will discuss very important topic in the exam. Till last May exam, it was one of the highly repeated stations in the exam. So it's very important to know how to deal with such patient. She will be very angry, and also with a postpartum complication, which is affecting the patient's quality of life, and it's very important to counsel the patient in a proper way. So let's start. We will have Dr. Rika to present the case with me, and then we will go for the feedback and to highlight the most important sentences or things to tell the patient about, so to settle her down, how to manage angry patient in any station, okay? But with the specific way for this station, okay, guys? So we will speak like generally speaking about any angry patient and especially for this station. Okay, Rika, are you ready?
Yes, doctor.
Okay, so we will start the 2 minutes reading time for you, okay?
Okay. I have time, ma'am, still?
Okay. Yeah, you can start, Rika.
Okay. Hello, Mrs. Reed Anderson. I'm Dr. Rekha in the postnatal clinic today. How would you like to be addressed?
Read is okay, doctor.
Okay. Reed, your age, please.
It's 32 years.
Okay. Reed, I'm really sorry for being late, and as the clinic is running late, we are working in this matter. We will try to avoid such happening in the future. May I proceed?
Actually, doctor, I want to ask, where is the consultant?
Okay, and please accept my apology for the consultant. My consultant is busy somewhere. I will arrange the next appointment with my consultant as soon as possible. If you allow me, I will discuss with you, and is that okay?
If I will say no, doctor, you will leave me for 12 weeks again. I'm waiting for 12 weeks now just to meet the consultant, sort my problem out.
I can see that how angry you are, and it's understandable. I acknowledge your concerns. Please accept my apology, and I try my best to address your concerns and arrange the appointment with my consultant as soon as possible.
I don't have anything to say, doctor. If I will say no, I will go home and I will stay in this miserable condition for another 12 weeks. So what can I do? Okay, whatever. Yeah. Okay, doctor.
I understand from your notes that you delivered 12 weeks back, and at that time you had the tear in the back passage, and now you are having some issues with bowel problems. Is that right?
Yes, doctor.
Ms. Reed, I'm really sorry that this must be a difficult time for you, and you have to take care of your baby, and you have this issue. I'm really sorry to meet you in such circumstances.
Thank you, doctor.
Mrs. Reed, can you allow me? Can I get a few details from you, and then we discuss the management plan? I try my best to address your all concerns.
Okay.
Mhm. So, Mrs. Reed, can you tell me more about your bowel problems?
Actually, doctor, you cannot imagine my condition now. I'm in miserable condition. Every day I have these accidents, and nowadays I'm not able even to go outside my home. You know, even I'm not able to deal with my children. It's supposed that I'm happy now with the baby and I have another child in home, I have another kid, but I'm not happy, doctor. Every
Mm-hmm.
day I have these accidents and with very, very bad odor. Cannot
Mm-hmm.
imagine.
I can see that how much difficult situation you are going through, and it's understandable. But let me tell you that we have some options available for you, and we will discuss in a moment. So, can you tell me either it is an loose or the hard stools?
Everything, doctor.
Mm-hmm. And do you have the sudden urge to pass the poop?
Pardon?
Sudden urge to open your bowel?
No, doctor. I don't have anything like that. Suddenly I found myself like this, soiled.
Mm-hmm. And do you have any control over your wind?
No.
Okay. So, now have you named your baby?
Yes.
And what's the name?
Tom?
Okay. And are you breastfeeding Tom?
Yes.
Okay. And any issues with the waterworks?
No.
Any pain, bleeding?
No.
Okay. So, have you received the antibiotics and stool softeners at that time?
Yes, doctor.
Okay. And are you currently on any medications?
No.
Okay. And do you follow the diet advice and physiotherapist
Yes, doctor.
under the supervision of physiotherapist?
For what?
Exercises?
No, I don't have any idea about that. What about this exercise? It's like going to gym?
So, did anybody explain to you about these exercises?
No, doctor.
Okay. And does anybody explain to you what happened at that time?
Sorry, doctor. Just explain to me what is the nature of this exercise.
Yes.
You
Let
told
me
me
tell
that
you.
somebody has to told me about it, to tell me about it. So just, yeah.
Yes. Let me tell you that we advise these exercises to every woman after the tear. Some squeezing, relaxing exercises under the physiotherapist advice to strengthen the muscles and to improve the tone and to reduce the chances of this leaking.
Oh, so you mean, doctor, that it has to be like this? Someone has to tell me about this exercise to avoid what my situation now. This is what you meant, doctor?
It's usually advisable, but in your situation, why this was not advised to you, we will going to look into this matter. And already the incident reporting was initiated. I will go through that and I will explain to you. We will be open and honest about that.
Okay, so do you think, doctor, was it a mistake that nobody told me about it?
It could be a mistake from our side.
Okay.
So, do you have any future pregnancies planned?
Yes.
Okay, and other than this, any health issues or any operation in the tummy and down below?
No.
Okay. What do you do for your living?
Actually, I'm a teacher, doctor, but I'm not able even to go to my work. I have
And you're,
because of these accidents and this.
I'm really sorry for that. Your height to weight ratio?
Around 27.
Okay, thank you for sharing your all this information, Mr. Streets. So, does anybody debrief you about that, or should I explain to you what the tier means?
Yes, they explained that to me immediately after the delivery.
Okay, so first of all, I will talk to my consultant about that, and we will refer you to the perinatal clinic to do an special scan to check the tone and the pressure of the back passage, if there is any abnormality or not. Am I clear so far?
Yes, doctor, very clear.
And also, we discuss with you some coping strategies. My specialist nurse will guide you how some coping strategies, like you can use some pads, and also we will advise you to take some. As you mentioned that, can you mention about the stool consistency?
It's normal.
It's normal.
Yeah.
Okay. Okay. So we will advise you to use some that is stool softeners if it is a hard stool, or if it is soft, then we will advise you to use a loperamide, and also will connect you to the physiotherapist for these exercises, and also my nurse will guide you how to train your bladder also. Sorry, bowel. Am I clear so far?
Yes, doctor, very clear.
Okay, so let me tell you that the 6 to 8 out of the women have the better recovery at the 12th month, but 2 to 4 women may have some issues going on as you are suffering, but it takes some time.
Okay. So I have to wait, doctor? I have to wait this time?
Yes, let me reassure you by taking these advices like exercises and some modification, avoiding the heavy lifting, and so this will be better for you. So, some personal questions I want to ask that have you resumed the sex?
No, doctor. No, you
Okay.
can see my
For the
condition.
contraception?
I'm not using anything because I'm not sexually active at the moment.
Okay, we will advise you to use the contraception when you resume your sex to avoid the unplanned pregnancy. So, in the if you become asymptomatic by the end of the year and your scan is normal, you can consider to have the vaginal delivery. But if remains asymptomatic, you will be offered the cesarean section to avoid such symptoms in the future. Any concerns you are having?
Yes, doctor. For how long I have to wait until this problem will be sorted out?
Most of the women recovers by the end of the 1 year, so it takes some time. Also, we will take OP.
Oh my God! You mean, doctor, I have to wait for 1 year without anything?
Actually, it takes some time. We will also maybe you get better, but it takes some time. I'm really sorry for that.
So, doctor, okay, you are sorry, but you cannot see my condition. Doctor, I told you that I'm in a miserable condition. You cannot imagine.
Yes, it's understood. I will give you the written information. It's very difficult.
Continue, Reka, continue. Okay, time's done, but continue, please. You will leave the patient? You will leave me, doctor, like this? I told you that I'm not able to go outside my home. I'm not able to go to my work. So you will leave me like this?
No, never. We never leave any patient in such a situation. We are always here to help and support you with these strategies, and I'm sure that your symptoms will get better. But it takes some time.
Okay, so I want to write a complaint, doctor, please.
It's completely understandable, and I'm also on your side. We have some patient advice liaison service. You can complain against us. I will guide you about that.
Okay. Okay, doctor.
Okay, I will give you written information, and it's very bad.
No, you are very good. Excellent, Dr. Rika. Thank you so much. And also for the time management, it was okay because the patient was very angry from the early
Yeah,
beginning.
yeah.
Yeah, but we managed to settle her down slightly or a little bit at the start, but you made again the patient angry when you left her without management. So we need, I will highlight this at the start, we need to refer her to anorectal surgeon. Yeah, because now it's 12 weeks postpartum, and without any, yeah, she might 60 to 80 will be asymptomatic by the end of the first year. Yes, I agree, but we are not able to leave this patient like this. But you managed to settle her down at the start, and it's very good point. The questions, it was all targeted and to the point, and also to help you in the management. Just I will adjust the management plan. So only the management plan I will adjust for you. Okay?
Okay. Yeah, ma'am. Okay.
So let's go with the detailed feedback. Your introduction agenda was excellent. Just you can ask the patient, is this Mrs. Reed Anderson? Like that. If you want to start like this, or if you want to start like the normal introduction, can I confirm your name and age, please? Like this or that, okay? So your introduction agenda was excellent. You can say, hello, I'm Dr. Rana, one of the doctors in the clinic today or in the department today. Yes, you have to involve, yes. We will not wait till the end of the year, because maybe there is problem with the tear, hidden tear, or problem with the healing. So at that time, the anorectal surgeon will offer her special test, the ultrasound and the manometry, to check what about the strength of the muscle. So you have to explain this to the patient. It's written clearly, guys, in the guideline that we need to refer the patient if you will meet the patient within 6 to 12 weeks. And still
First we do the endo-anal ultrasound, and if it is abnormal, then we refer, or we directly refer to the colorectal surgeon.
You have to refer directly. Okay? And explain the two tests for the patient. What about the aim of that? And as I told you, Rika, it's written clearly in the guideline. If you will meet the patient between 6 to 12 weeks and this patient has fecal incontinence, refer her to the anorectal surgeon. So we need to refer her. Even this patient is affected. Her quality of life, she's not able to go outside. She's not able to go back to her work. And it's very important things here in UK. You know, they are searching for the quick recovery. They applied the recovery program for that. So they need the people to come back to normal, to come back to the normal life, the normal activities and the work as well. Okay, you got it?
Yes, ma'am.
Yeah. So let's go with the detailed feedback, as I told you. So you can tell the patient, I've gone through your notes and I understand that you are here because you have a problem with your back passage, or as you told her, Rika, you have this perineal tear and now you have a problem. This patient from the start, she gonna say, pardon me, doctor, where is the consultant? So you will be in shock. It's not written that she has to meet the consultant. So
yeah, it was not written here. Yeah.
Yeah, exactly. And it will be the same in the exam. So take care of this point, and excellent, you covered this. You covered the late clinic at the start. You apologize about the late clinic. Very well done. Take care, guys, that in the exam, you might see 1 or 2 stations late clinic. So they need to see how you will apologize to the patient, and you need to investigate more why this happened, why the clinic is running late, and to avoid this in the future. And the second apology has to be regarding the consultant. Here, it's not written, but the patient will give it to you like shock. Where is the consultant? And she will be she will be very upset and frustrated from this point. I have to wait again to meet the consultant. So excellent, Rika, you covered this in a very good way. Just reassure her that you know her case and you went through her notes, and the consultant updated you with everything, and you will set another appointment as soon as possible. So as soon as possible here in UK, it means within 2 weeks, which is like very, very fast referral or setting appointments. So within 2 weeks, just say as soon as possible, like you did exactly, Rika. Coming to the information gathering. Now here, guys, we are in the postpartum module, complication. It's a complication. So at the start, ask the patient open question. Okay? Don't ask closed question. You can ask the patient, how are you today? Okay? Would you please tell me more about your problem? And also at the start, ask the patient about the baby. And excellent, Rika, you did it. You asked me about the name of the baby, the breastfeeding, and how's the baby. So it was very good point in the communication with the patient, okay? And then we have to analyze the complaint itself. So now this patient has fecal incontinence. We need to ask about the bowel work. What about the incontinence? Is it for just stool or flatus as well, or both? Because it means that it's like a higher degree of the incontinence if it's for everything. And since when this started? Immediately after delivery. If you asked me this question, Rika, I'm gonna say it started like 10 days after the delivery.
Okay, I didn't know this one.
Yeah, you can ask this question. Add this question. It will not affect your marks here, but you can add this question. Stool consistency, and you cover this. Is it loose or firm or hard? So she's gonna say it's normal. Are you still on stool softeners? It's very important question. You asked me all together, like antibiotic, painkillers, and stool softeners. And if I stop this, I said yes. So very well done. You can ask specifically about the stool softeners because in another station, guys, it is the
She was using two stool softeners.
Exactly. Very well done, Rika. The third day postpartum. So you will meet the same patient, but she's on the third day, still she's admitted in the hospital. She has accident today, just today. When she went to the toilet, she found herself soiled. So what to do at that time? We have to ask about the stool softeners and how many. So she's gonna say 2 stool softeners. We have to stop one, and we will keep the patient admitted until she's okay and discharge her. After that, give her the follow-up appointment. Here we have to ask, what about the stool softeners? Because some of the patients will still taking it because she find like it's good to have like normal nature or going to the toilet every day without any problem. Or she has or had like a pain after the delivery for a while, but with the softeners, this pain, because the stool now is soft, so the pain, no pain, and she's still on it. Okay, so we need to be sure that especially the stool softeners stop or not, and you did it, Rika, very well done. She had the antibiotic prescribed for her, yes or no, and you can ask for how many days or just antibiotics. Okay, did you receive the antibiotic? Yes. The painkillers? Yes. The stool softeners? Yes. How many? 1. Have you stopped this? Yes, doctor. It will be like this. Pelvic floor muscle exercise, very important question, and very well done, Rika. You covered this. Because here, we need to initiate incident report. Okay, incident report and involve the risk management team. So the famous question here from other candidates. So now we initiated incident report immediately after delivery because it's a complication, it's a perineal tear. Yes. So we have to initiate another one? Yes. Why? Because here, this patient has wrong prescription. I didn't mean wrong prescription like medication, like wrong management. Why nobody told her about this pelvic floor muscle exercise and explain to the patient? Even I was wondering, is it like going to the gym, doctor? So just explain. It's like squeezing of the muscles in your lower tummy. So we have to advise you regarding this exercise because it will reduce the risk of the incontinence or problems with the stool or with the poo. So here, initiate incident report. I will mute you, Rika, sorry for that. And if you want to speak, just unmute yourself, just to have a clear recording, okay?
Okay.
Thank you, my dear. So pelvic floor muscle exercise, guys, here it's a crucial question. It's very important and you have to ask about this. And we will stop at this point and the patient will start to ask, is it a mistake? And is it a mistake? It's a very common question in any complication. So the answer will be for any station with a complication. Like in this patient, pelvic floor muscle exercise wasn't advised or prescribed for the patient. Angry husband, for example, patient with hysterectomy, any complication. Is it a mistake, doctor? So you have to be at that. Usually my advice to my candidates, just try to be gray in this. You know the gray zone? You are not white, you are not black. You are not against your colleagues, you are not with or defensive for your colleagues. You got the point? So don't say, yes, it's a mistake. Now you are against your colleagues. Don't say, no, it's not a mistake. You know that it's one of the complications can happen after the delivery. And you sign the consent for that. So now you are against the patient, you are defensive. You know? So just try to be in the gray zone. Yeah, so just say, is it a mistake, doctor? How we can answer? Just say, I totally understand your concern. And if I'm in your place, I would be same like this or even more. However, at that time or at that point of time, I'm not able to tell you, is it a mistake or not? We need to investigate more to know why it's not prescribed for you or nobody advised you regarding this. And when we will come back to the result, we'll be honest, transparent with you about it. You got the point? So here, just in any mistake, any angry patient, patient with another famous, this question famous in another station, and it's now a famous station in the exam. It's a new recent recall, but it's in every exam. The patient with placenta accreta discovered accidentally during the cesarean section. And the patient started to bleed and hysterectomy was done. So the role player will ask you definitely in the exam, was it a mistake or is it a mistake that placenta accreta wasn't like diagnosed or to be seen by the ultrasound? So don't say, yes, it's a mistake. No, it's not a mistake. It can happen. Yes, it can happen, but don't say that. So how to answer the question again, guys? Just be in the gray zone. I totally understand, or your concern is fully understandable, or I do appreciate your concern. Make your own sentences, which you will be familiar with, guys, in the exam. Just to make your own sentences and way to counsel the patient. Okay, you can take my way and just make like little adjustment to fit you, and it's okay. You can use in the exam. So I do appreciate your concern and your anger, or I know that you are frustrated, and it's totally understandable. Okay, and if I'm in your place, I will be the same or even more. However, at that time, I'm not able to tell you, is it a mistake or not? We need to investigate more. And once we reach the final conclusion, like to know if was it a mistake or not, we will be honest, transparent with you regarding the results. So the patient will be settled down. Okay, guys? So let's continue. This is all the history of the present illness. And you know here, the discussion during the information gathering will take long time, like it was with Rika. Because the management, it's just few lines in the management. Here, the main point or the main aim of this session, station, just to know how to settle the angry patient down, how to counsel her, how to answer her questions. And we have another question. It will come now. Okay, guys? Another question from the role player, and it's very common in this station. Personal here, as we have postpartum complication. It's not, you're welcome, my dear Rika. Thank you so much, my dear. So it's a complication, guys. So we need here to ask the only important question. So just ask about smoking. We need to add this question here, Rika. Why? Because smoking will affect the healing. So if the patient is a smoker, we will ask her to stop or just to reduce until she will stop the smoking, because smoking not good for her health. This is number one. Number two, it will affect the healing of this tear. Okay. The BMI also important, because if the patient has a high BMI, it's another risk factor to have like a problem with the healing as well. Drug allergy also very important, because we may need to prescribe anything. You asked me about the consistency, Rika. If this patient has like stool, a soft stool, at that time you need to prescribe for her something to, not to make the stool hard, just to make it firm like normal. So we need to exclude any drug allergy. Any medical problem of concern, any surgeries done before in your tummy or down below, any family history of concern, asking about the mental health, and you can see that this patient is anxious, frustrated, and angry. So we need to support her. We will reflect on that. All the questions we will ask, we will reflect on the management, like asking about smoking, so smoking cessation program. Asking about the mental health, we will reflect on that by offering a counselor or psychologist to support her and to just to learn her how to cope with her condition. It will be like that. So the history or the information gathering was good from your side, Rika. Just add a few questions. The examination here, very important. You didn't examine the patient. We need also to add the examination and also justify Why do you want to examine the patient? Just we want to see the tear. We want to see the healing. We want to see if the skin around this tear, because of the incontinence, is affected. You may need to offer the patient cream for excoriation or infection or inflammation, anything like that. So just tell the patient, I'd like to offer you examination in presence of chaperone after your permission. Is it okay? Okay, doctor. Just I want to have a look on this tear. I want to be sure that the healing was good, and also to check the skin around it or around the back passage to be sure that there is no infection, inflammation, or anything. Is it okay? Okay, doc. Okay, guys, so this is the examination. Then explanation of the condition. I like from your way, Rika, when you asked me that anyone discuss with me, what about the tear? So I have like good understanding about the tear, and my answer was yes, because usually this will happen like before discharge the patient, you will discuss what happened exactly. Explanation of the perineal tear itself will be for the other case, you know, the third day postpartum, and she has incontinence one time this day. So at that time, you have to explain the tear. You can draw for the patient, this is the back passage, and this is the frontal passage, and what happened that during labor, if you want to know how to, this is the frontal passage here, and this is the back passage. And normally during labor, we might need like to make an opening here or not. It's not like for every patient. Sometimes with some patients, there will be a tear here. And according to the degree of the cut, we will classify it into first, second, third, or fourth degree. And I'm so sorry, your condition is the third degree perineal tear. So it's a tear here between the frontal passage and the back passage. So just simple to draw for the patient. Here you will not explain, because you will ask the patient if she has good understanding, and her answer yes, okay, move to the next step. I want from you at the start reassurance. So I'd like to reassure you, read that around 60 to 80 women out of 100 will be symptoms free by the end of the first year. So don't worry, everything will be okay, and we are here to support you. Here I put the questions from the role player to know how to answer. What about the perineal tear? If she knows everything about it, and then skip. The second question, this question, if you will ask her, tell me more, what happened during the delivery? She's gonna say, so my delivery was with the midwife, and suddenly she told me that we have a problem now. We have a tear, and she called one of the doctors to fix or to do the repair. You know, doctor, I feel that the doctor and the midwife, they are not competent to do that. Very famous question here in this station. So how to answer this question? So just reassure the patient. I'd like to reassure you that there is no one or no healthcare provider will touch the floor before being doing workshops and training for that. So I'd like to reassure you that all the healthcare providers are competent. Here you will be defensive. You will not say, I will investigate. No, because we know that no one will do anything before he has like assessment, training, workshops, and everything to be done here. Okay, so this is the answer of the first question. The second one will be to write a complaint. And take care, guys. Don't say, you have the PALS office here, go and write a complaint. It's your right. Yes, it's her right. But don't say, because now you are against your colleagues. Wait until the patient will say, I want to write a complaint, doctor. So at that time, yes, it's totally understandable, and it's your right. So we have here an office in the hospital. It's named PALS, or Patient Advice and Liaison Services. So you can go to them, write a complaint, and they will keep in touch and be back to you with the final results. If the patient requested, so take care of that. You need to initiate incident report regarding the pelvic floor muscle exercise, and you did it, Rika, in an excellent way. Coming to the management. So here, no multidisciplinary team, but because in the domains we have communication with the colleagues, and usually I love to say it's my beloved domain, because with one sentence you will get the 2 marks. You know that in the exam, each domain, you will be assessed either 2, 1, or unfortunately 0. So when you will tell everything about this domain, which is communication with the colleagues, okay, if you will tell your management will be with a group of expert team, you are involving as much subspecialties as you can, you will get to, which is pass in this domain. So if you will find the communication with the colleagues in the domains outside the cubicles, in the case notes, just be happy, because you will get the 2 marks without any effort, with just one line or one sentence. Okay, guys? Even my advice, because of the 2 minutes, it's like you will not be able to finish all the case notes. So you are not sure what about the domains there, or you forgot. Just keep it in your management, because it means that I'm involving other subspecialties. So you will get marked in the applied clinical knowledge. Sorry, guys. In the applied clinical knowledge, and you will get marks in the patient safety, because you are involving other subspecialties with you. So just tell the patient your management will be with a group of expert team, including my consultant, specialized nurse, exercise expert, back passage surgeon, and here I will add also a counselor. Don't forget the counselor. Okay, guys, and exercise expert to start the exercise. Yes, it has to be immediately after the delivery, but we can start it now just to make the muscles in your lower tummy strong. Okay. So the management plan, we first reassure the patient, then involve many subspecialties in her management, and then now what we will do, read. First of all, I'd like to refer you to anorectal surgeon, which is a surgeon dealing with the back passage or the bowels. So just explain what is the anorectal, because anorectal, it's a jargon. Okay, so a surgeon dealing with the back passage. They will offer you 2 tests. One of them named endoanal ultrasound. So it's exactly same like the scan done for the baby, but it will be for your back passage. We want to see the healing from inside, or if we have any hidden tear inside. And another test named manometry. This manometry is just to measure the strength of the muscles around your back passage, because sometimes it will appear normal, but the function not good. Like it's normal in appearance, but it's weak. So we will see how to manage, and this will be the job of the anorectal surgeon. Am I clear so far? Yes, doctor. The second thing, I will refer you to the exercise expert. So you have to start this exercise as soon as possible, even if it's late, but it will help to keep the muscles strong. Am I clear so far? Yes, doctor. If you didn't mention the incident report, so just tell her that I will initiate incident report and involve risk management team regarding this pelvic floor muscle exercise. Why nobody told you about it? And stop laxatives if the patient's still on it. So I put like different things. If you have anything of that, you will apply. If the patient's still on laxatives, so stop laxatives. Moreover, we will provide you with the pads also suitable for that. Sometimes there is what we named anal plug, guys. It's written in one patient information leaflet. The patient can use while she's outside. So we can help her just to go outside, okay? But it's not like familiar for everyone to tell the patient about this anal plug. If the patient has any problem like infection, inflammation, excoriation around the area, so offer her a cream for the management. If we have soft stool, offer her a medication to keep the stool firm, and also refer her to dietitian to help her regarding the diet, which will keep the stool firm. After that, coming to the future pregnancy. Here, if the patient will not ask you, please cover this point. It's part of the management. So even without the role player asking, yes. So please, you can ask like Rika did. She asked me, any future plan to have a baby? I said yes. So I'd like to tell you, Reed, that there is risk of recurrence, 5 to 7%. It means 5 to 7 women out of 100 women will have the same condition again in the future pregnancy. I'm so sorry to tell you about that. I'm not here to scare you, but just to be honest with you. Am I clear so far? Yes, doctor. So for the upcoming pregnancy, we will follow up you and see. If you are symptom-free at the time of the pregnancy, guys, we can advise you regarding the vaginal delivery or allow the vaginal delivery after your permission, but we will do some precautions during that. We will advise you regarding some massage you can do to the area before the delivery. And during the delivery itself, we will offer you support for this area down below. And we might need to make like a cut. We have to make a cut to avoid this tear from happening again. One of the indications, guys, of the episiotomy, if the patient has a perineal tear before. And take care that after the perineal tear, this area will be fibrosed and it will not be like soft like normal, so that the risk of the tear will be increased. The other thing, read, if you still has symptoms, I'm so sorry to tell you that, or the test done by the surgeon, the back passage surgeon, which is the endoanal ultrasound manometry, guys, if it's abnormal, at that time, we need to consider the cesarean section also after your permission. Is it okay, Reed? Yes, doctor. So do you want to ask me about anything? No, doctor. So now I will give you the patient information leaflets regarding what we have discussed today. And I will set another appointment with my consultant as soon as possible. We will arrange for the follow-up and I will make all the essential referrals and I will attach you to support group. Do you want to ask about anything? No, doctor. Thank you. Thank you. Okay, guys, so this is how to go smoothly in the management. You know, all the management with the surgeon and the test and the future pregnancy will not take more than 2 minutes. So you'll consume most of the time counseling the patient about what happened to her and to just to try to settle her down. The patient safety points here, the good explanation, and you did it, Rika. You asked me about the tear, but you explained the pelvic floor muscle exercise, which has to be done to me, and you reassure me also. Appropriate management plan, yes, to some extent, but at the anorectal surgeon with the 2 tests we need to offer for the patient. I will share with you guys a screenshot from the guideline. When you will see the patient between 6 to 12 with fecal incontinence, refer her to anorectal surgeon. Drug allergy, we need to exclude any allergy. Cervical screening, actually, no, I will not ask her about cervical screening because the patient has a postpartum complication. If you will ask, no problem at all. Maybe this patient, she missed the appointment while she's pregnant, so you need to reschedule her again, okay? But for me, because she's angry, I will not ask. Stop laxatives if the patient still on laxative. Okay, guys? So this is how we will cover this station. Do you have any questions, guys?
Dr. Rana, after the scan, I mentioned the colorectal surgeon. So anorectal, colorectal, the same thing. We can see in the specialist who are specialists in this field.
Keep it like back passage surgeon.
Back passage surgeon. Okay.
Okay. Any other questions?
Ma'am, regarding the as I ask about the have you resumed the sex, this is a right question to ask or not because she is having the complication.
Yes, it's a good question, but usually the patient will start to be angry, but don't worry. It's when she will be angry, it's part of the exam. It's marks, guys. So when you will, any question, just keep this in your mind. Give the patient time to ask. Give the patient time even to be angry, because you know, when the patient is angry and you will settle her down, it's a mark. When the patient will ask a question and you will answer, it's another mark. You got the point? So yes, you have to ask her, because giving her contraception, it's not the patient safety points related to the fecal incontinence, but it's a safety points for any patient postpartum to avoid unwanted.
She's already 12 weeks.
Exactly, yeah. Okay, any other question, guys?
Thank you so much, Dr. Rana.
You're welcome, Dr. Rika. Thank you so much, my dear. Okay, guys, so that's all for today. We will stop here and I will post the recording on the group. If you want to discuss any other case you feel like it's a little bit difficult, please just pop a message, just put it on the group. We will discuss next time, but the time will be, I will schedule my time, because at the time there's a lot of things to be done. We will discuss the cystic fibrosis, how to counsel the patient regarding cystic fibrosis, okay? It's also a recent recall in the exam. So if you have any problem with any case, just send either a direct message or on the group. Okay, guys? Yes. Yes, and it's a new station for the last 2 exams. So it's very important to cover the cystic fibrosis. Even last exam, it was a twin pregnancy. So we need to see how to counsel the patient in this situation. Okay, guys. Thank you so much for the post-operative RICA.
Yes, ma'am. Post-operative, any complication arises to the post-operative patient, any ureteric injury, like any complication after the surgery.
Okay, so if you have any difficult one, like urine retention, this is a new station as well. If you want to discuss it, guys, just write or drop a message on the group.
Okay, ma'am. Thank you.
Thank you, Rika. Okay, guys. Thank you so much. Thank you for your nice performance today, Rika, and thank you for attendance, guys. And see you, inshallah, in the next session. Thank you so much. Assalamu alaikum wa rahmatullah.